Finally, if you remember, I don't remember last month sometime, maybe 3 weeks ago or so, I told you that I go to Dunkin' Donuts and I ask them to make sure they put enough cream in my coffee, and I'm really not supposed to have cream. Basically, the bottom line is that this happened to me like earlier this year or last year, I think happened. They were making the coffee too strong, and it was giving me I can't take acidic coffee. It really messes up my stomach really bad. And they were making it so strong that this woman who had heart problems thought she was going to have a heart attack. And I called them several times. Now, I don't know what happened. So this was last year. So now, that my son had to cut a class and I had to wait for him, I went back, different workers, and they were putting enough cream so that it wouldn't be bitter, and I was fine. But you have to tell them that, or else they're going to give it to you bitter. So this new lady is there. I said to her, just make sure you put a little extra cream and a couple more pumps of the pistachio, because they make it so bitter I don't taste anything. So she charged me extra, which upset me, and she put too much cream. I mean, the coffee was almost white, and I was like, oh my goodness. So, let me get out of here. And I started drinking it, and I started feeling, I don't know, that's a little, it was hitting my stomach a little hard. And unfortunately, that week, I love my white chocolate coffee, and McDonald's used to have it every Christmas, every holiday. They didn't this year. I found some white chocolate coffee creamer at Kroger. And usually I just put a little bit of cream, again, because it is too acidic and it will kill me. So I usually put a little bit of cream just to take out the acidity, to give it enough flavor. And I love my white chocolate so much, I was putting extra cream. And then I went back to Dunkin' Donuts at the end of the week and said, remember, please don't put a lot of cream. And I should have said, I guess when I said a lot of creams, again, she made it almost white. And I'm drinking this, and I'm not feeling right. And I started feeling that pain again. And I'm like, crap. So I said, okay, it'll pass. It usually lasts me a day. It'll pass. Last time I went to the emergency room was because it wasn't going away, and my eyes turned yellow. My eyes to me were looking a little yellow, but my daughter said, well, it's not as bad as the last time, and I thought, well, this time I said, let me drink some straight up black coffee, see if it just pushes all the fat out, drink my fiber, see if it'll just push all the fat out, and hopefully this will pass. No, I was trying to eat. As soon as I ate, the pain would intensify. No matter what I did, this pain was getting worse. It started like Sunday in the wee hours of the morning, and by Monday, evening, I couldn't take it anymore. It had been over 24 hours. The pain was getting worse, and I told my husband, you need to take me to the emergency room. And so he takes me I told him, let's go to the one by us. I don't want to do that other place again. And I said, I know that the surgeon who was making me get all of these, clearances, he works at the hospital up the block. Just take me there, because he's there. Even though he only met me once, he at least knows some of my history. He's seen some of my records. So we went there. When I got to the hospital, when I got to the emergency room, there's only one person ahead of me. After I got there, about 10 more people came behind me. It's a very small emergency room, so we filled up pretty fast because these people had friends and family with them. So they called me in like maybe within 20 minutes to talk to me about my pain and ask me a bunch of medical questions like they always do about your medical history. And then within another half hour, they got a wheelchair and they wheeled me in and brought me into a bed. And the first thing I can tell you is that bed was so comfortable. It was so comfortable compared to the other beds I've been in the other two hospitals I've been in here in Houston. And as soon as they wheeled me in, the pain went away. That was because they had explained to me that the reason why the pain flares up when I eat is that I have pancreatitis. because the gallstones, they move around, they block the ducts, and then the pancreas can't do its job and the liver can't do its job, and that the pancreas is overproducing acid, and that's why I'm in so much pain, and the food probably finally digested, and that's why I was fine. And so they said, I can't leave, I need to stay, I need to have a doctor check me out and talk to the surgeon, because that's really bad. Pancreatitis is bad, you can't mess with your pancreas, and I really needed to stay. So they shot me up with this painkiller, even though I think because my pain I don't know if my acid started acting up. I'm not really sure even why, because sometimes I think they just do things routinely, and like last time and this time I felt like I didn't really need it yet, but I was getting a migraine, and so they gave me this thing, and it felt like my whole body went on fire for a couple of seconds, and then my whole body just relaxed. And I was telling my husband and the nurse, I was like, I don't know how a drug addict can get addicted to this feeling, because this feeling is awful. Why do they get addicted to the drugs? And I think someone said pain. Well, I think the nurse said because of pain, they're trying to manage their pain or whatever. I was like, yeah, that's true. I mean, I know a lot of drug addicts are trying to take away their emotional pain. A lot of drug addicts and prostitutes turn to that. A lot of prostitutes I found out were molested and learned that sex was the only way to get money and things that you want. And drug addicts are trying to mask the pain of being molested and, stuff like that. So, I said, well, physical pain does make sense, because that pain was awful. I just wanted it to stop. So they gave me that, and then something for nausea, because I felt like I was going to throw up, but like everything has subsided. I don't know why they felt the need to do it at that moment, but I can't remember, probably because something was acting. I know I was getting a migraine. So they said, we don't have enough beds in this hospital, and we might send you to our other hospital out in Clear Lake. And I was like, no way, because I want to be near my family. I don't want to be far away like last time. And my husband has to drive my son to school, and I don't want him driving my son to school and then driving to get me and then back home from my daughter. It just would have been too much for him. And, because he has to work too. It just would have been too much for him. And so she says they'll keep you in I think they said observation, and then get you a bed in the morning over there. No, this is what she said. The doctors don't come till morning over there. I said, well, if the doctors don't come till morning over there, and the doctors don't, and there's not going to be a bed available until morning over here, I might as well just stay here. But they probably wanted the room for one of the other 10 patients. I'm like, I don't want to go out there. So someone, I think I was there for maybe an hour or two, and the doctor had said, we found a bed for you upstairs. Basically, because all those 10 people had come in, half the maternity ward was empty, and so they had to give up that other half of the maternity ward to us. And so they said, they had to give it up. So they bring me up to the room, and night and day to what I went through out in that private hospital 4 years ago, night and day from the one I was in just last month. There's an attending on staff, because the first thing I said to them is, if I'm in pain, I want something for pain, and I want something to help me sleep. And they're like, oh yeah, we have an attending, so your nurse can order you whatever you want and then get it from the pharmacy. I was like, okay. So my husband was flipping out. He was frantic. He's scared. He's like, he didn't want to leave my side. I said, look, you need to take our son to school. He's got 2 more weeks of school left, and all his work done, he will fail if he misses out. He's already missed out 3 days. You're only allowed to miss out 3 days. 2 were for mental health appointments, which that's not going to get canceled. And then the emergency when I went to the hospital the last time. So I said, so all this work he's done in these past 5 months are going to go down the drain, and all the driving I've done, all the sacrifices I've made. And so he was all upset and all freaked out, and I just said, look, just go home, just sleep, just take him to school, and then come see me. The doctor's not going to, if they're doing surgery, it's not going to be till the afternoon, because I still have to see the doctors. So they brought me up to the room again. It was like luxury in that comfortable bed. again, night and day to what I went through in the other two hospitals in those beds made of bricks. So they laid me there, and my husband said goodbye. It was like the biggest room I've ever been in, because it was meant for a husband and a baby to be in. It was a maternity ward. It was just so comfortable. My husband leaves, and I had this nurse that was so good to me. She took such good care of me. My migraine, first of all, one of the side effects of that is migraines. And I was like, but they were trying to treat my migraine with it, and it actually made it worse. Basically, the only way to cure pancreatitis is to not eat. And then if the doctor's going to do the surgery, all this, whatever swelling and inflammation is in there needs to go down so that he can see. So that night I was very comfortable. I slept very well. The nurse was giving me, I think she gave me pain medication again. They gave me blood thinners. I didn't know they were giving me high blood pressure pills. You know, and I wondered if it was the losartan. I was afraid to take it, and it took me a whole month to actually get the courage to take it. And I had already been taking it for a couple of days, and I wondered, was that affecting my gallbladder? Because none of these issues started until I started taking medications. And I'm on a low-fat diet. That's why it's hard for me to go to the bathroom. So the reasons he was saying, I was thinking it has to be the pills. That's why they told me I couldn't take metformin. So I thought maybe it was that. But they were like giving me Tylenol. They were giving me blood thinners. And my blood pressure was, again, it was like 200 over 100. My blood pressure shot down and kept going down from 170 to 160 to 150 to 140 to 130 to 120. It went from 100 to 90 to 80 to 70 to 60 to 50. And it was the blood thinners. And the reason why they don't like you taking blood thinners before surgery, but you have to have it so that your legs don't clot from laying in the bed. But that's what worked, because I've been taking losartan since I got out of the hospital, and my blood pressure is back up. But anyway, she took such good care of me, giving me pain management, you know, giving me whatever I needed. Again, as a matter of fact, when I got into the room, when I woke up, they brought me some food. And again, they're not, I keep telling them I'm diabetic, I can't have sugar. And they keep bringing me sugary, like Jell-O and stuff like that, and I couldn't eat. And the minute I ate, the pain would be so intense from the acid forming. So I was not allowed to eat. Because of that, my migraine is getting worse and worse. And this nurse, she did everything. She would call the doctor, she would call the pharmacy, everything to try and manage my pain. She took such good care of me. So the next day I get a male nurse. My throat is a little dry still from the surgery, you know, from the intubation. So I get a nurse, a male nurse. He's really nice to me, but I'm starting to panic, because I'm remembering when I was in that hospital in Houston 4 years ago, and the nurse didn't come until 4 o'clock for 4 seconds and walked out. I'm waiting all day for a doctor. I get one doctor in the morning. He says to me, "Look, we're looking at all the chemicals in your body. You need gallbladder operation. You need to wait for the surgeon to come." So the surgeon comes in, and you know, he kind of scolding me because I didn't do what he said the first time, and I kind of got snippy with him, because I already gave him my reasons why I didn't do what he wanted me to do the first time. So he says, "We're gonna have to order your records, because they did all your hard testing in the other hospital. Your insurance is not gonna want us to do it again. We're gonna have to order your records." And I'm waiting and I'm waiting and I'm waiting. I can't eat. My migraine is getting worse and worse. And I kept, every time I didn't call for the male nurse. He just kept coming in, check on me. I kept asking him anything about the records. So, you know, they were saying that, oh no, well, basically because it was so late in the day. They were not responding, and I wasn't getting my records. I'm like, "Look, I haven't eaten. I have a migraine. I'd like to be able to eat again." So, you know, because I knew that's why I had the migraine. And I don't know if there's some sort of contracts with Tylenol, because the hospitals do not carry naproxens. They will only give you Tylenol. And so he was really good. I did finally call him. I saw it was getting late, and he promised me that they were gonna. They're working on it. That sometimes it takes 48 hours, and so I was stressed out. And he was really nice about it. I guess I was stressing him out when he would come in, but he was like really nice about it. And so the records closes at 4:30 or something, and because I think what happened was that the no the I think what happened that Tuesday was the surgeon didn't come till really late, and I kept saying, "Are you sure he's coming?" Because I remember, it's already 7 o'clock. He's like, he's coming. I'm telling you, I know him personally. He's a great guy. And he showed up at around 7:30, and still no records. I'm like stressed out here. I'm severely stressed out. I have this horrible migraine. Nothing's helping. And they kept giving me that drug that made my body feel warm. At this point, it was like helping me to relax. Well, they gave it to me, I think, maybe twice by this time. And I remember the male nurse telling me the reason why it's helping you is because your body hasn't adjusted to it yet. This is habit forming, but people's bodies get used to it very quickly. So you're lucky, at least it's giving you some sort of relief. It would help me relax a little bit. I'll take a little bit of nap, have weird kind of violent dreams, in and out of sleep. And so no records. That really sweet, nice nurse took care of me the whole night. I was in such severe pain, and she was telling me, take the narcotic. And I'm like, I don't want to take it. I'm afraid. She's trying to get me to take pills. I said, no, the doctor said I can't eat anything. I can't take anything in my mouth, and I want the surgery. And so she's trying to manage my pain without drugs, and I was in, so not only that, but my because I have back problems, my back was adjusting to this new sleep position. I always sleep on my side, and now I'm sleeping like this. I was in such severe pain, and she's telling me, take it. I'm like, no. She felt so bad. She said, look, it's okay. You're allowed to take medicine by mouth. And since the doctors, they only stay for a few minutes and leave, they he wasn't giving he wasn't always telling them what he wanted, or they had to call him, they had to wait for him to call back, his approval, blah, blah. And